Patient 5213 is a 92-year-old female who we are seeing in an acute care setting. She lives alone in an assisted living facility, but she enjoys playing bingo, playing games on her tablet, including Candy Crush, and doing some puzzles. Before she retired at 80 years old, she was a waitress, and she had an acute right basal ganglia posterior limb anterior capsule infarct, or an acute CVA on the right side of her brain. After her stroke, patient 5213 demonstrated deficits related to balance, vision, strength, and endurance, particularly on the left side of her body because it was a right-sided stroke. The goal of this activity was to improve static and dynamic sitting and standing balance in order to have her sit on the edge of bed and improve trunk control and other occupational activities. This kit is a 3D maze in order to facilitate the balance. We can use it with the magnet by dragging the ball through the maze from point A to point B, or it can also be used on its own, and the client can go ahead and tip the maze using their hands to guide the ball through the maze. Again, going from point A to point B, this facilitates different kinds of client factors as well as balance and crossing midline, visual discrimination, and other. Because this tool can be used in many different ways, we can also grade it up and down. This can help to facilitate many different kinds of conditional factors that people have and can help with lots of different occupational performance deficits, which helps it be a very versatile tool. When we implemented the kit on patient 5213, she was pretty good with it. We did make some modifications in terms of some non-slip mats underneath so that the actual kit did not slip, and we also made sure to tape the underside of the magnet so that it did not scratch the plexiglass, because that was an issue, but other than that, everything went pretty smoothly. This activity is a skilled service because it facilitates many different kinds of performance issues that it addresses. It can address dynamic sitting and standing balance depending on how it's used, trunk control, visual discrimination, problem solving, crossing midline, visual neglect if they have to scan in order to move the ball around the board, as well as gross hand grasp and gross motor coordination. This can also be used if the patient is sitting on an exercise ball in order to facilitate that kind of trunk flexion and trunk control and dynamic sitting balance. And it can also be used on its own instead of using the magnet to draw it around, and that would also help with some different exercises in that way. So this activity is considered a task-oriented activity because it is having a means to an end where we're trying to get from point A to point B with the ball, and this is used as supported by task-oriented and occupation-based interventions. This would be considered like a leisure activity because patient 5213 enjoys puzzles. This is something that she enjoys, and since it is an occupation-based intervention and task-oriented intervention, this benefits patients post-stroke as found by a couple of different studies. Wolf et al. And Pachiapan et al. Also found that this was beneficial in post-stroke patients who were having balance deficits and other kinds of occupational deficits.